So, greetings and welcome to all the listeners of our latest podcast session today. Today, we shall explore two different yet tentacular worlds of medicine and academia with our special guest, Dr. Rajiv Kumar Jain, a health and hospital administrator with a vast experience in hospital accreditation, quality in healthcare, health administration, epidemiology, child health, hospital and healthcare strategic planning, medical regulation, and much more. It is our privilege to have you today as our guest for this session. I would like to express my heartfelt gratitude and welcome you to our Health Audit podcast series. I request you to say a few words about how you feel about being a part of this session today.
Thank you, Shreya. On behalf of Health Tech, I want to thank you have people and your team and for us and to think of inviting me for today's podcast. I'm to understand your perspective in the context of the health technology as well as technology's impact on healthcare in general. And I'm looking forward to an interactive session with you. And hopefully, uh, the listeners and the viewers would gain something more, and the time is spent together would be useful to all the people. Thank you.
Absolutely, sir. To have you today for this session, we have this great opportunity now to learn from your immense knowledge and experience. We have prepared a few questions for you then, and our listeners are keen to dive into this insightful session then.
Great.
Let's start. Yes, sir. Let's start with the first question, your day to day life. What does your normal working day look like, and which skills do you think are most tested in your work?
Well, when we say skills and application, I feel today's world cannot be completed, or today's day cannot be completed, or days could not be completed without technology. We are all the time enveloped, so to say, with technology, whether in the workspace, in our personal life, or our community life, or family life. So people who immerse themselves into technology and master technology uh, definitely have an edge over the people who have not uh, made friends with technology. I feel whatever be the domain knowledge that they have, whether literature, science, sociology, or entire gamut of knowledge, so to say. Today, the boundaries between different so-called sectors of knowledge is now evaporating with this explosion of uh, knowledge and data, so to say. So I'm almost say waking up life is using technology for knowledge and knowledge acquisition as well as knowledge dissemination and knowledge sharing. And since I'm a health professional, definitely anything which impacts life or health, so to say, more than disease, I would rather say, uh, I get interested in and I learn a lot, I share a lot, and I uh, enjoy being part of this great times that is happening in India, where knowledge and technology are coalescing together, in especially the health sector. And I'm really excited the way technology is impacting healthcare today. So that's why I in fact welcomed this interaction today.
Yes, sir, absolutely. As you mentioned, there is an intersection of technology now with healthcare and medicine. But the earlier used to hear these words about medical education, the first thing that used to pop in our mind was studying and practicing medicine. But today it is not just limited to biology and pharmacy and just a medical doctor. We have students from technical fields and various other fields as well, working in the healthcare sector now. With the ever changing dynamics, sir, of this field, what do you think the future will look like? And the technology, infusion of technology into the healthcare sector, how do you think it can specifically help?
Very important and relevant question, Shreya, you asked. Uh, One example. which actually throws light as to how the world is living. One of the most successful company donated more than 1,000 crore rupees to Indian Institute of Science, Bangalore. And imagine for what purpose they donated a money for. It was to set up a kind of fusion center for healthcare and health technology and science, where hospital, where and people who are actually have knowledge of technology, science, and medical sciences. Not only medical, when I say medical sciences, it means the entire gamut of biotechnology, life sciences, and medical science, including clinical, paramedical, clinical sciences, together working in one knowledge hub, which is Indian Institute of Science in Bangalore. And that is, I think, it's very exciting. It's second is you saw IoT Kharagpur setting up a medical college and a hospital. I feel they reflect the changes that are occurring in India. Earlier, what I used to see, most of the people who were learning into computer science wanted to graduate and researching into technology impacting healthcare. They used to go to US and they used to become biomedical engineers or health tech engineers, where they used to find better opportunities. But today, the tables have turned. But if you see the startup ecosystem today that is coming up, the major trust has been on educational technology and health technology, where it is actually impacting the life of individuals. Examples are many, but I would like to share two, three Indian startups. 1MG, I feel, is a good example where uh, Tata's had to buy it because they thought that the business model is worth progressing. And if you go deeper into how it has changed the entire healthcare setup, you would realize that how technology, if it is used for people's welfare in the health sector, can really make a big change. And COVID naturally catalyzed this I think, uh, the change which was inevitable, but it made it run faster because it became so much essential from just being a need. It became so much a part of people's survival, so to say. Not even life. Became so much essential to be, able to catapult yourself into using technology for a gain of knowledge in terms of your own life and in terms of professional life as such. Another example which I would keep on uh, coming back to is the use of technology for immunization, vaccination, and development of vaccines and diagnostics and therapeutics. Technology helped a lot. If you see the COVID portal or application, COVID application, would it be possible without uh, the ecosystem existing on the base? The people who were able to develop in India, biggest, I would say, platform, which could actually, so to say, give solutions to the problems which were existing prior to COVID. And now you are seeing that same platform will be utilized for, populating the entire vaccination for children. Even tuberculosis now in that ecosystem now, tuberculosis control. The number of diseases that were almost finding no traction in terms of scaling up, reaching the unreached, had it has been possible through technology to reach the unreached. In Indian situation, it's crucial because unless you are able to reach the unreached, how would the problems of India in terms of diseases of communicable and non-communicable disease, how they could be even uh, touched or tracked, so to say. Technology gives that edge where you are able to, assess a real-time situation, real-time data, and real-time interventions and real-time evaluation and monitoring. That is a big, big power. I think that makes that will make India healthier in the long run.
Absolutely, sir. That is a very thought provoking and insightful answer. And I think our listeners would gain a lot from it. Now, just following up on your previous answer, how has the advancement in technology helped in the diagnosis of disease and providing healthcare overall? Can you elaborate on the implementation of EHR, electronic health records, which has helped in improving the functionality in hospitals?
Right. Uh, Over the past 20 years, you have seen uh, the transformation in the hospital sector in India, only having fragmented, standalone, or owner-driven, owner-managed, doctor-owned small nursing homes. Today, we have good number of hospital chains with a brand with quality, brand with care, brand with professional excellence, brand with validation of their entire processes, and also outcomes in terms of their processes in terms of their ability to tackle diseases of diverse nature and their robustness in terms of their geographical spread in the country. Come to think of it, today only I was reading that how Dr. Reddy came from US and set up Apollo Group of hospitals in way back in '83 in Chennai. And today, look at Apollo. They're almost in all parts of the country. And not only there's space for so many other brands which has happened. Could it be visualized 20 years back? No, it was not possible. But it did not stop there. When you talk of electronic health records, almost all these big and middle level chains have embraced electronic health records and found a base where consolidation of electronic health records becomes easier because on the base of the entire EHR record system in these hospital chains, there's an overlay of uh, hospital record system within the government sector. Think of already Institute of Medical Sciences, think of many hospitals, PGI Chandigarh, or even all other names. Now they are actually using EHR on a real-time basis. The real challenge now, which fortunately National Health Authority is trying to tackle, is creating a uniform, portable electronic health record system, which is and which is also secure, which is also portable, not only portable but also available on demand and on request of the user. So privacy is retained, yet the the mobility of the individual across public and private sector becomes easier, and also it becomes more easy for knowing as to what, where, and what health interventions actually happen across the country and across healthcare system. So it has given a power which is, I think, which will unravel in the years to come. Foundations have been laid, and public money is now being made available for this great project. If you look at the National Digital Health Mission and its funding pattern, you will realize that we have come of age. What US could not do, we are doing as a public service, and that too free of cost across public and private sector, across not only public and private sector, across the scale of hospital and primary, secondary, and tertiary level healthcare setups. you cannot neglect the role that health and wellness centers are going to play. And from day one, health and wellness centers have EHR integrated into it. So that would be the foundation of primary healthcare. And if you marry this with the hospital EHR records, you have such a robust system of knowing where, when, how health and disease are interacting on a dynamic basis. That lays the foundation of a research ecosystem. Now, if you build these two into the demographic scale that India has, the kind of numbers that we have, kind of diverse population that we have with diverse genetic makeup, you can imagine the explosion in knowledge, and with knowledge comes the power of intellectual, I say, growth, because now diseases and health, the spectrum from health to disease could be tracked. And once you track it, you can actually find new ways of solving the existing problems, which will be India driven, India based, and India specific solutions. I think that is the real power that EHR is going to bring. And the foundations are there for, I think, the commitment for the union government and the state governments and the entire ecosystem on the ground is visible now. That's great times, I would say.
Absolutely, sir. That does make me very proud that India is able to achieve that. Um, and I think our listeners would love to hear your opinion as you just shared. Now, sir, we have learned that technology is a great supplement to the healthcare system. But, sir, the healthcare workers are the backbone of a medical system and they must work in a healthy environment themselves. So, how is the concept of a healthy workplace applied to the healthcare sector?
So crucial question you've asked, Shreya. Without occupational safety of healthcare workers, you cannot imagine a safe environment for the patients or the users. When I say patients, I also include the visitors or the people who accompany or the companions to patients in the healthcare ecosystem. Indian culture actually welcomes not only the patient but the caregivers as well in the health system, unlike in the West, where caregiver is excluded mostly from the healthcare sector. Indian healthcare system actually embodies the caregiver, the patient, and the caretaker, the entire health team together. So in this journey, I think it's most important to actually understand what are the causes for or the risks involved for the healthcare workers, irrespective of their level in the hierarchy or in the healthcare team. In terms of ability to track, detect at the earliest the risks that people knowingly or unknowingly expose themselves to, unless you break the entire health delivery system into the different stages and track it online through technology, it would be almost impossible to control those risks. So it becomes a, very important actually to understand that without the use of technology, occupational safety uh, in amongst the healthcare workers cannot be tackled. We have been trying this for since ages by having checklists, by having training, capacity building initiatives, and supervision, and requesting the healthcare workers to report any mishaps or any safety issues while they are working in the health sector. But what we have seen again and again, uh, there is a tendency to hide the mishaps that occur, which does not help anybody. But with technology, it's possible to actually understand those risks. Excuse me, and also ensure that those risks are minimized. It is impossible, of course, to have a zero risk in healthcare sector by its very nature. it has ability to cause infections and injuries to healthcare workers as part of their healthcare delivery journey. But definitely, with use of technology, it is possible. And there have been number of examples within the health sector, especially operation theaters, and especially critical care areas in the hospitals, where it has been proven that uh, safety issues can be tackled by use of technology on an ongoing basis. EHR also is helpful. Evaluation of electronic health records becomes easier if safety issues are inbuilt. And also, one is able to track over a longitudinal uh, period of time that what is happening, whether improvement is occurring or if improvement is not occurring. What are the ways in which you can tackle the risks that are happening in the healthcare sector? So it, definitely it has made not only uh, the life of the healthcare workers safer, but it also ensured that infections are not transmitted from the healthcare workers to the patients or their companions or their caregivers when they come for interaction with the healthcare team in any hospital, whether it's primary, secondary, or tertiary. Another benefit that has happened because of use of technology has been the tracking of antimicrobial resistance within the healthcare system, and sharing of this data across hospitals and across critical care units, across neonatal ICUs, has helped ensuring uh, controlling those infections and minimizing the use of antibiotics, which not only saves money but also ensures a safer environment for the healthcare workers as well as the patients.
Yes, sir. Absolutely. That is a very good answer, sir. Now, sir, as we all know, during the recent pandemic, as you also mentioned, the occupancy of hospitals and our healthcare centers and all rose to a very high rate. What were the major challenges that the hospital administration faced during these times? And what do you think could have been done better now that we look at the past?
Yeah, very as a topical question where the word resilience, I feel, is it comes to the fore. Uh, if it, in terms of planning, in terms of resources, in terms of innovation, in terms of using your inbuilt capacity, or in terms of using your own resources to ensure that the sudden upsurge of patients of the diverse uh, needs with no solutions for the disease. And that is good, I feel. It tested India's ability uh, to the hilt, I would say. And India came out on tops on that. Now, in terms of challenges that were there, first was science. Science means the disease was, since it was new, knowing the antecedents of the disease transmission process, and also the vulnerability of individuals across home, community, workplace, uh, even schools, or business areas or offices, and health sector, whether it's primary, secondary, or tertiary, was involved. With the time, the if you see the pandemic, how it was spreading across, or the way it was rising and coming down wave after wave, it meant that you need not be so panicking all the time, but you need to be prepared. And the the data was the biggest weapon, and data helped in actually ensuring uh, tracking of the issues of not only the virus, but also the way it is getting transmitted across the community. Now, once that was happening, sufficient time for preparation of the facilities had to be taken. So that time through administrative measures was gained. Whether you say hard lockdown or soft lockdown, doesn't matter. but lockdown was a necessity in the beginning. And how to dynamically, relax the lockdown also required the help of technology. You see, the crucial change which happened was on one platform, wherever you get tested, whichever place you get tested, it has to be available on the COVID so that district health authorities know where, when, how people are getting detected. So the scale was visible to the people who could do intervention. That's one. So technology marrying with diagnostics and also source neutral. That means public, private, it doesn't matter. Wherever you could get, you are tested, you are on. The data is available on COVID. Simultaneously, laboratory facilities development, technology development for vaccines as well, where you could actually prepare better because you can not create enough manpower in such a short time, but you can create defenses so that the scale of infections and severe cases is minimized. The only way was on a war footing work on the vaccines. For that, if you see, vaccines in the world cannot be made unless you have a good biotechnology setup. India was fortunate in having a full ecosystem of biotech where not only the testing facilities but also manufacturing capacities and also the network of laboratories in the biotechnology field were available much prior to the pandemic. So India had that edge of being prepared. Now on the hospital side, this this wave two was the biggest challenge because it created a unique challenge in terms of need for oxygen facilities, which was not there in wave one. The unique nature of the infection and the the way uh, the need for oxygen arose out of nowhere, which was not happening in wave one, uh, also gave a strength to the capacity of how much you can create within a short time. You saw how uh, oxygen generation capacity could be improved. Oxygen, not only generation, but also storage, but also transport, and ensuring that oxygen is available across health sector in dynamic manner where people's life could be saved. But if you forget that unless you keep training at the backup, you would never achieve people's confidence to actually transfer that knowledge into care. Technology also helped in capacity building during the pandemic. If you see number of training sessions that were organized for across for nurses, for technicians, for doctors, for critical care physicians, for cardiologists, for respiratory physicians, neonatologists, you name the specialty. The training sessions were held across. Uh, Unless you had technology, it would not have been possible. Like Honest Institute was training all the medical colleges in one go. It never happened in the past. So whatever was happening in New Delhi, the Apex Center could be transferred in the shortest possible time to all critical care physicians across the country in all medical colleges. So that knowledge base became strong, and that knowledge base was uh, it met global benchmarks. So, if you, in a nutshell, if you have to say capacity building in terms of size, in terms of its translation, in terms of scale, and I'd say its ability to be implemented on the ground, not only by a healthcare team, but also district administration and political administration as well. And people's confidence could be created over a period of time just because technology and the hospital administration and the, I would say that the governments and the private sector were working with single focus to control the pandemic. Nobody, in fact, thought of who is the owner of the facility, whose life you're saving, but the single focus was saving lives, and lives got saved. Now, in hindsight, it it proves to be a godsend that India had that power of this entire ecosystem happening. It could not have occurred if we would not have prepared in advance. We would not have been uh, having those facilities or the mindset to be able to tackle, and the confidence that we had that it is possible to manage. And if you see what happened in other countries or even in developed countries, it gives you more confidence that we could lead this process again and again. So we are better prepared now for the future pandemics. And in that process, we have also learned how to manage the existing problem that we have. If you remember, people who had diabetes, who had hypertension, were more exposed to COVID. So people, you could understand the interplay of infectious and non-infectious diseases, interplay of communicable and non-communicable diseases, and how the environment plays a role in ensuring that you do not get a severe disease. You cannot forget the role of environment. If you recollect, more polluted cities had more problems. So the environment, your genetic makeup, the ecosystem that was having transmission, uh, entirely, I think that helped in actually striking home the point of One Health. I think that One Health means the hospital is not in does not stand in isolation of the community. It's part of the community. It if it has to be able to stand as efficient hospital as owned a hospital of the community, it has to care for the community. Means it has to care for the people. That means it has to care for the environment and the diseases that are prevailing in that area and prepare well so that it is able to deliver the services whenever, wherever, in whatever scale it is required. I think that is the biggest uh, lesson that hospital administrators learned through this pandemic. And through hard work, I would say, I must compliment the entire healthcare sector as well as the team supported the healthcare sector to be able to deliver under very constrained environment.
That is a very inspiring answer, sir. And we truly respect every health worker that worked in the pandemic to save our lives. And as you mentioned, sir, training played a crucial role in curbing the pandemic. So, for any underlying problem that we have to solve in a nation, education plays a crucial role in tackling it. So, what changes do you think can be made to the education system so that our medical sector has a better and safer future, be it the inclusion of technical training or something else?
Well, very, very difficult question to say, but I'll try to answer it to the best of my ability. Education is so fundamental to open people's mind. See, when you talk of education, in fact, pandemic, post pandemic, people have started understanding the value of education. Earlier, if you see pre pandemic period, dividing knowledge into silos can be harmful for uh, finding innovative solutions, not only in science but in life. So this process of openness of knowledge acquisition, that's fundamental. I want to uh, focus on this issue. Uh, Education opens people's mind to finding solutions to problems which mankind faces of whatever scale, whatever nature, and whatever impact they may have on current generation or the future generations. It is only through education that this is possible. Now, over a period of time, what happens in India, if you also go back to a school, if you start your education, you are driven to, you're almost forced to specialize either in, you say, in Indian language, it is either the engineering stream or the biology stream or the life sciences stream. Hardly anybody uses life sciences in India, unfortunate. But you say either medical stream or the engineering stream, which is, I think, is not correct way of looking at things. And fortunately, the new education policy allowed uh, so-called people willingness to move from one silo to another silo, and also uh, at one time uh, gain knowledge in various domains of knowledge, even in humanities for that matter. Ultimately, what happens? The solutions come from people who have an open mind, and that I think education, if it is driven for focus on finding solutions to the population, whatever be the knowledge base required to solve those problems. I think that is the fundamental base for which education is required for. Now, what happened during this pandemic? The medical education got changed, engineering education got changed. Increasingly now, the I would rather say having engineering colleges within the medical colleges, or medical colleges within the engineering colleges, is the way to go. If I narrow down on my domain, so to say, or where technology and medical sciences uh, can never be separated in future. It's impossible the way things are happening. Increasingly, you would find, and the third marriage that is happening now is marriage of technology, medical science, and management. Now, I'll give you example. Uh, AIMS Jammu is under setup. They have devised a program where IIT Jammu, IIM Jammu, and AIM Jammu together are offering courses. One other example I gave in of Indian Institute of Science, Bangalore, or IIT Kharagpur. And there are a number of examples, but Pilani is another example, where medical professionals, if they want to acquire specific knowledge in specific areas of their interest or research, they can go and spend time together with other professionals having that domain knowledge, and come back and continue working in trying to find solutions. Well, unless you go through make teams with diverse knowledge, it is impossible to find solutions. So the change is in the outlook, and that is a big change in educational philosophy now, and which is going to stay. It's you if you see you have a solution, or you have some basic, for example, vaccine, unless you have tools to make it acceptable to people who need to be delivered that vaccine, unless you have the technology to actually ensure that this vaccine reaches in a viable condition to the people where they need it, can you find a solution for it? You cannot. So you have to have knowledge of management, which requires a whole breed of knowledge base, and also technology and medical science is so fundamental. And also, interestingly, earlier, clinical sciences used to be at the top of the medical sciences knowledge base. Suddenly, you find diagnostics, even biotechnology, even research, even biochemistry became very important. Why? Because they're so fundamental to finding solutions to our diseases. Another example I would like to give, where uh, people require knowledge of social sciences. You have if you have to find ways of communicating the risk to the population, can you do it without knowledge of anthropology, sociology, and I would say even history? You require knowledge, economics you require. You have to understand the ways in which this knowledge has been artificially divided in the past. Understand your knowledge need and acquire that need, and then move forward. This dynamic way of knowledge acquisition and knowledge usage, that is, I think, it's exciting phase. Education now is getting transformed. Even today's session, how your club, Health or Tech, you see, could anybody could think of 10 years back, Health or Tech in VIT Bhopal, or any other institution where computer science is being taught, or even other disciplines of engineering sciences is being taught? No, because today the students are able to think in innovative ways, and it's possible within our medical professionals. A change is actually happening in terms of embracing diverse knowledge base and using that knowledge base for better healthcare. A bit longish, I feel.
No, sir, I loved your answer. It was absolutely thought provoking and it was a great answer, sir. Now, sir, coming back to you, we have loved your opinion and your answers on health tech and the advancements that we have been going through with technology in the healthcare sector. Uh, you have been working passionately towards improving the healthcare sector. So, what is one thing that inspires you to work with such enthusiasm and sincerity?
A very, very difficult question. Uh, it's very difficult to say what one thing inspires, or what one thing which actually uh, keep me going. I would say uh, the the patients, the way they want to solve their problems, the way they define their problems gives new insight every day to uh, find solutions to their problems. And I'm when I say problems, I don't mean only health problem, because I feel health individual can be ever separated from the family or from the community the patient comes from. So I find uh, that unique nature of each patient keeps me going. I think, or keeps me always excited to find a unique solution to unique problems of that individuals. And if he's coming today and he's coming tomorrow or day after, how his need changes with time. Ability to find a unique solution for that moment, I would rather say, not even for the day, keeps me going. And that is the most exciting, uh, I say, stimulus which keeps me going. That I think it's unique in our profession. That, but I find in technology also that is happening, because the way things are changing, you can never say what you've learned today that's going to be useful for, say, 2 years down the line. You've got to keep learning. Similarly, we in our profession learn through each interaction with the patient, and that is the biggest gift that we have, and that keeps us going, and that keeps us motivated. That you cannot master, because the needs of patients would be so diverse. You'll be surprised to find the problem that people face, whether they are physical problems, or they are mental problems, or they are psychological problems, or they are spiritual problems as well. The mind is so fertile in the people's mind. And even look at the young children's mind. If a 5-year-old child comes with a problem, he would not open up when his mother is there. But when I ask the mother to go out, he opens up gradually, and you find solutions coming up. I think that keeps you going.
Absolutely, stuff. Uh, so, what has the most challenging part, I would say, of your career till now? Something that you'd like to share with the listeners?
Well, uh, challenging, most challenging, I would say, is at times I feel this, this technology could have come earlier. Uh, I feel uh, kind of India uh, could have gained much better if we could have embraced technology much earlier. For I would rather say better healthcare. Uh, but it all the same, India is trying to face its problems now in a better way. Uh, Challenging is also patients' inability to afford treatment. Challenges are also in terms of people's inability to find solutions in the areas that they live. I find these are the more problems I find solution. The problems or challenges are in terms of social structures or the support system that we have. Lack of, say, uh, very wide based health insurance or a health assurance system in our country is a big challenge I find. And over the years, I've also found uh, that gender and gender discrimination is also a big challenge in our country. Which we as health professionals know much deeper than many of the sociologists also would have written about it, but we have seen it up close. But then changes are coming. There have been great advances, and now it's more equitable. And I feel uh, challenges are worth facing because that gives you the confidence that you must keep trying to solve or to meet those challenges so that you are able to be more strong to meet higher challenges in the days and years to come. And that I think is most important. The drive or willingness to meet up those challenges is primary importance, I feel, from my perspective.
Absolutely, sir. That's a great answer. So, you have an experience of almost 40 years in the healthcare sector. So, how would you describe how India has advanced since when you started? And what is the one problem that you think is not often talked about in the healthcare sector and something that needs to be dealt with in the future?
Well, interesting question. Uh, there has been a huge change in terms of the health care system in India, and knowledge base also has exploded. Uh, Along with the explosion of knowledge base, there has been explosion of knowledge sharing, which is so wonderful to realize. Uh, Along with this, one thing which has happened over the last 40 years in India is a kind of sensitivity for trying to solving the problems of the uncared people, unreached people, or people who never were, were part of the healthcare discourse in the past. Today, I find reaching the unreached has become a buzzword, which is so good to feel. In terms of, uh, I feel now in terms of the way forward, we in the healthcare sector feel, uh, or I must say, I should not own up others, but I would rather feel uh, the way things are happening for India. Uh, One should be able to focus uh, undivided attention to finding more robust ways of health research in general. When I say health research, I am not deliberately using the terminology medical research, because health research is much wider field than medical research. Uh, Health research agenda, when we say it needs to be strengthened tremendously in our country because of our unique problem that we have. Unless we have a very strong health research base, it would be impossible to even try to replicate Western solutions in our country. The only way that we could find India specific solutions to India's problems is having a very robust health research base. And for this, we require a kind of reorientation within the mindset of players in the healthcare sector, whether they are healthcare professionals or they are engineers or they are professionals from other domains. Uh, I mean, when I say other domains, it almost means people from the management domains, people from uh, you, humanities domain, so to say. Uh, if if an ecosystem of health research is set up where all the knowledge domains together uh, try to solve our unique problems, that I think is the way I'm looking forward to. And fortunately, the way things are happening now, right from Niti Aayog to many of the think tanks today, uh, have started talking about health as a major agenda for the model of governance that the country needs, which is amazing. And if this thought process has come to this stage, and the kind of investment that is happening, if you see the budget, if you see in percentage terms also how much percentage of GDP is being now spent on health. When I say health, directly it's spent on health. There are indirect is expenditure on health as well. So this is gradually taking traction, and I feel now the way things will look up, we could be a good focus or the base for the health research at the global level as well, where we give solutions to the world. And like in the past, when Western world was giving solutions to us, I think that uh, is the way I look forward to. Yeah.
I think our listeners would derive great insight from your answers, sir. And lastly, my question to you would be, you have significantly contributed to the advancements and you have given us such great answers today as well. We are curious to know that how we as students and common citizens of the country can contribute to bring powerful and positive changes in the healthcare system.
Wonderful question, Shreya. If you feel this question needs to be asked, I think that is the most important beginning. Thinking of that you can is the most important issue, even more important than how you can, because only then you start the journey of exploration, and through this exploration of your own unique solutions for, if you look at as an individual, uh, you could think of the problem that you, if you just go back to your childhood or go back to your school, go back to your hometown, go back to your community where you live or where you come from, you would realize that there are certain problems which are unique to your environment or your community. This willingness to identify, willingness to find appropriate solutions is the biggest weapon that you have, because through this process only you would be able to discover in what unique ways you would find solutions When I say solutions, I'm talking the context of healthcare sector, because in the past, what has been happening? We have always been disease focused. From a disease focused thinking to a health focused thinking, I would rather go to the extent of wellness focused thinking. It is you who can drive this agenda to be changed forever in future. Because the disease agenda has to be a very minor portion of the entire health agenda. The major portion has to be wellness and health agenda. How to ensure that you remain well most of the time, you remain healthy most of the time, and also you have the power to maintain your health, so that the need for disease or disease intervention, disease alleviation or rehabilitation is minimal. That will save huge resources for the community. And that resources, not only in terms of money power, not only in terms of our GDP, not only in terms of our ability to flow that saved money into more productive, more robust educational system, more robust social services across the country, can really have a big impact for the future of our country. So, from my perspective, I look forward to a student led, student driven, and student designed health intervention or health agenda or wellness agenda for the future of our country. And that is what I think the real uh, way the health status of this country is to improve. There's no other way. And this is the only way. In fact, if we continue to focus on disease, we will reach nowhere. That is the high cost solution. If we continue, if you change, if you can bring home this participation of students like you and like your uh, other students in your institution and other institution, collaboration with other institutions, the health agenda and wellness agenda comes to the center. And I think that is what I'm looking forward to. In fact, that is the biggest message that I want to communicate today. That this discussion on disease has to be peripheral, and the central focus has to move to health and wellness issues, and how we can ensure that this health and wellness become and remains at the center of not only discourse but also action in the months, years, and ages to come.
Absolutely, sir. I think our listeners would really be inspired by the points that you mentioned. And I hope that this impacts and inspires positive action in all of us.
It's been really exciting actually to interact with you today, and I did realize that it's been more than an hour that we have interacted. Uh, Thank you for actually inviting me and also throwing up insightful questions, which is the catalyst to finding solutions. I'm grateful for all the time. When I'm grateful for this opportunity. I look forward to interaction in future. Thank you so much.
Thank you so much, sir. Dr. Rajiv, I would now like to take a moment to just express my gratitude for the session that we had. It was very insightful, and your expertise and your insights are truly valuable. And I learned personally so much from our session together. I appreciate your willingness to share your knowledge and your experience with all of us. Thank you once again for your time and for making such a positive impact for all our learning. I look forward to maintaining contact with you and putting to action what we have all learned today.
Thank you so much.
Thank you, sir.